Shiri, you can hear me, right?
Yeah, I can hear.
All right. So I start my talk today. I start. Can I start?
Yes, yes. Can you
Oh,
start?
okay. Okay. So hi, assalamualaikum, and a very good afternoon, everyone. So my name is Dr. Norfida binti Ismail. So for topic for this week, we talk about asthma. So how asthma is developed in our body, and also how does the reducing electron therapy can help most of the asthma patients. So basically, I know some of you out there will say like, oh, we have only asthma. Asthma is not one of the serious issue. But if let's say this is continuous, yes, it will have a very, very serious issue. So this one can lead to death. If let's say you don't know how to counter it, you don't know how to tackle it. So asthma, you can see how to say asthma disease is, you can see like small, you can say not a very severe issue, but it can be if let's say you don't know how to take care of it. Okay, so I share my slide right now. You can see now. So the next time, before I'm sharing for all others, you should know by the end of the session, you should know what is asthma, what are the types, sign and symptom, the causes of it, and how does the prevention and how the treatments available in the hospital. So as first now, I will share you the article of asthma. So this two article I find is quite fascinating because as you can see the article on your right side, is taken from the WHO data. So as you can see there, according to WHO data published in 2018, asthma death in Malaysia reached at 0.76% of total death. So this calculate we can ranking Malaysia is on 82 ranking. So I know some of you will say it's not a very major issue, but it could be in the future or soon or later. Why? You can relate on the article on the next on your left side. So you can see the perceptions of childhood asthma and its control among Malays in Malaysia. So we can see that most of the asthma patient is developed during your childhood. So maybe because of your parents or your family members doesn't have how to say doesn't know how to take care of asthma. So from childhood you already have asthma. So this is what I said. You need to change your mentality. This is a very small issue. It can be big because of your careless. So this is what start to happening in our society right now. Okay. So we're moving on for the what is asthma. So I know you know already asthma is okay. It's just difficult to breathe in. You cannot breathe. No, you need to remember, you need to know asthma is a long-term of disease of lungs. So you need to know it's a long-term effect, long-term disease of lungs. So your lung is, how to say, it's not like working properly. So this is happen. Okay, when this is happen, it causes your airways to get inflamed and narrow. So it becomes, when the beat becomes smaller, it's as difficult to breathe in. Why? Some severe case, the patient or the person cannot talk or cannot breathe in properly. Why? Because the airway is like the supply of oxygen, carbon dioxide, it make it you breathe. So when your airway is inflamed and narrow, so this is what asthma will take over. Okay, so this is what is asthma. And the next one, I will share you types of asthma. So we have 4 major types of asthma. I know some of you will say asthma is, oh, I just know asthma, that's it. Actually, you need to know 4 types of asthma. Why? So later you know how to counter it and how to come over it and by prevention it. So you need to know what asthma are you. All right. So you can see the first type of asthma. The first one we call as mild intermittent asthma. So you can see mild intermittent asthma. So the first mild intermittent asthma, usually we can see the symptom. The symptoms is appear with 2 days per week. So this is we call as a mild, just a beginner of the asthma. And the second, mild persistent asthma. So mild persistent, you can see the symptom twice per week. So it still have, and you have it difficult a bit of your breathing. And the third one, moderate persistent asthma. So 1 each day. Okay, so 1 each day you having difficult for inhales or having difficult for breathing, and sometimes you will be coughing. All right, the last one, severe persistent asthma. So this is occur. Sorry. Oh, nothing. Okay. So, severe persistent asthma will occur almost every day. So we can see maybe usually at night you cannot sleeping. You have a difficult breathing, all that. So it cause occur almost every day. So you can see that this type of asthma, you need to know which type of asthma are you, so that you can counter and you can do the treatments. Okay. And the next one, these are the causes. So I know some of you will taking these issues like very lightly because of the causes of it. You're not how to say you're not taking care of that. So you need to know what are the causes behind it. So simple. The first one is the pollutions. The causes of pollutions. So you can see the air out there. You can see air out there is like quite dusty right now and have a lot of dust and microorganisms a lot. We cannot see the dust. We cannot see the microorganism because it's very tiny species. So that's why we cannot. So we just breathe. You just breathe. So this is why we come from the pollution. Okay. And second, smoking. So you do know that smoke contain a lot of chemical substance, nicotine and everything. So it will cause you lung having how to say it's not working properly because of the smoking substance, the chemical substance inside of the smoke, the cigarette. Okay. And then the next one, pets. So usually we can see the pets is among the childhood, among your children. Why? Because I know some of you is like pet lover. You have a cat, you have a dog, all that. So if let's say you love your pet, in the same time you love your children, you need to know how to clean up your pets. That means the fur of them and how to limit your children with the pets. You need to know how to taking care of both sides. So if let's say you just like leave and be like let them mingle around, playing around, can, but need to know what are the consequences, what are the hygiene of that. Okay, so before it become worse, you need to know what is the next happening. Okay, the next one, of course, from bacteria and viruses. Okay, the next one, genetic. So genetic is we cannot help because it's your body, your DNA. So that's mean it come from your parents, your family member, your mom, your dad. So maybe it's like maybe in soon in future your children have it or your grandchildren have it. So that's genetic. And the last one, fast food. I'll just simply mention fast food. Why? Because fast food contain a lot of high and a lot of cholesterol. Because why? Because it is a fast food. We are like dealing with a high quality of fat and high quality of oil. So this one can be, remember the airway I said the first one. So the airway part become narrow. So why? Because of the cholesterol also plug in, build up inside the blood vessel. So this is why one of the causes of asthma. Okay, so this is just I just mentioned randomly, like about a seven of sign or symptom that I can see a major general among the patient. So the first one the patient will come is coughing. So they will having coughing very frequently. All right, and the second one allergy. So allergy it depends on what kind of allergy you have. Maybe you're allergic to seafood, dust, or that. It will blockage your airway also. And the third one, common cold. Of course, you have your fever, running nose. It also blockage your airway. And fourth one, tired. You're lethargic. You having you cannot breathe properly. So that's why you feel tired because the oxygen doesn't enough in your body. And fifth, chest pain. So when you're having difficult breathing, you need to push, right? You feel like very want to push your body itself. So that's why we cause the chest pain. And the next one, sleeping trouble. So you're sleeping trouble. You having sleeping trouble because of you cannot sleep very well because your oxygen is not enough in your body. You cannot sleep in, you cannot breathe properly. That's why you having a sleeping problem. And the last one, the wheezing sound. So most of the asthma patient, you can hear the sound of their breathing is a bit difficult, and a bit weird also. Okay, so these are the seven signs and symptoms that you should be aware if let's say you have developed of asthma or developed beginner of asthma. So some of the seven of these signs and symptoms it happened to your child. Okay, so you need to alert with them. All right, and the next one. This is about the treatments. I just mentioned 4 major of treatment. So because asthma, you should know one thing about asthma. Once you get asthma cannot be cured. Okay, asthma cannot be cured, but the symptom. Remember just now I said the symptom. Okay, this symptom can be cured. Okay, so this kind of treatment, we focus more on how to treat the sign of symptom just now. Okay, so we have like four major treatments. So the first one, long-term medication. So usually we give inhaled corticosteroid and also theophylline. So for for inhaled corticosteroid, usually we give for several days or 2 weeks, and also is the type of medication usually we give is flovin. Okay, and the next one, theophylline. Theophylline is a daily pill that helps to keep your airway open. So you just take it, and your blood vessel will become bigger to breathing, to make you easy to breathe. And the next one, quick relief medications. So quick relief medication, we also divide into two types, which is oral or intravenous, and the next one, corticosteroid. So for oral, so just to keep your easy to breathe, that's it. And corticosteroid, just to relieve the inflammation of your airway. And the next one, your allergic medication. So this one is for those who are having allergy. Just now I mentioned is allergy to seafood, nuts, and also dust. So this usually the hospital we just give an allergy shot. That's it. So to reduce the immune system, to take care of the allergies, and to make it narrow. To make it bigger, your blood vessel. And the last one, this is what we usually the doctor will adjust at the very last resort, which is we call bronchial thermoplasty. So bronchial thermoplasty is to reduce the smooth muscle, this inside airway. That's mean this is your airway. So we are cutting a bit of your muscle there so that you can breathe properly. So this is the last resort. We can say this is a major one. Okay, you need to know treatment for asthma. We just not we do not treat asthma. Okay, we just treat the sign and symptom. All right. So the long-term medication, quick relief medication, allergic medications, and the last one will be bronchial thermoplasty. All right. So the next one, I'm pretty sure some of you said, I'm afraid to take medication. I'm afraid to go surgery. So we do have any other way because prevention. This is not what we can say. If let's say you are very serious issue and very the last resort, you need to go. You need to do some eating medication and you need to do some surgery. But if let's say this is just prevention, so that's mean prevention is better than cure, right? So we need to know how you prevent this asthma will happen. So the first one, we first focus more to avoid the asthma trigger. So the asthma trigger just now is the smoking, the allergy. So you need to do, maybe if let's say you have an allergy with the dust, you need to limit your outdoor activities. So maybe you can do some indoor activities, some sport indoor, like maybe like exercise, Zumba and everything. So you can avoid this kind of dust outside. So please avoid asthma trigger. Maybe you move away from your smoking person, all that. So you need to avoid. Okay. Second one, monitoring your breathing. So you need to monitor your breathing. So some of the asthma patients, they know already when they will need to happen, when is the set, when is want to breathing. So some of them they doesn't know. Suddenly, I'm having a difficulty breathing. Actually, she or he have asthma, but she doesn't know. Okay, so you need to know how you're breathing. Is it okay or not? All right. So maybe you're coughing suddenly, you're short of breathness. So that's why we say monitor your breathing. And the third one, of course, medication. So whatever doctor is like suggested to you, you need to take regularly or like once a week. So you need to follow. If let's say one of the day that you skip, maybe it will interrupt your difficult, maybe you interrupt with your breathing. All right. Next one, healthy food. So of course, whatever disease in the whole world, the prevention, the first one will be the healthy food. So the healthy food that I can suggest to you for asthma patient, usually three things, three vitamins: vitamin A, vitamin D, and also magnesium. So vitamin D, mostly we can say that for milk, we can get vitamin D from milk, from your eggs. All right. So vitamin A usually we can get from dark green vegetables. So like carrots, some kale, all that. So the next one, magnesium. So magnesium usually we get from spinach or pumpkin seed or broccoli. So again, Healthy food, we have three types of major vitamin that can help asthma patient. So which is vitamin D, vitamin A, and also magnesium. All right. So the last prevention, I mean, this is what we do lah. Okay. This is what we do. RET. You can see I just simply highlight the RET part. So we call as reducing electron therapy. So this is what we do as an alternative treatment. So basically, reducing electron therapy is a biochemical reactions by giving the electron towards your body. So we give negative ions. All right, it's not harmful at all. Just we give negative ions toward your body, and the main effect of it is like five. I just mentioned five: regulation your autonomic system function, proper hormone function, that means regulate your hormone imbalance or not balance, increase your immune system, I mentioned just now, the white blood cells, improve your homeostasis, which is make it your cells healthy, and the last one, improve your blood circulation. So this is, okay, so these are the main effect of reducing electron therapy that will help your body. Okay, okay, so how does reducing electron therapy can help most of the patient? I highlight here four major functions, which is this reducing electron therapy can help most of the asthma patient. By first, reducing infection and inflammation. So again, remember just now I said the airway become inflammation, narrow all that. So reducing electron therapy function to reduce the infection. So by increase the white blood cells. So if let's say you follow my last week of talk, I mentioned that white blood cell is to fight any bacteria, any microorganism, or any weird substance come inside your body. So this is what we call as a soldier. So when we increase your white blood cell, so this one can help to fight your all bacteria or viruses, all that inside your body. And the second one, improve your blood circulation. So that means your blood will move smoothly. So that means no traffic jam at all. So your blood will run smoothly and having no difficulty. When this is happen, it's easy the blood to carry, to transport the oxygen and carbon dioxide from your body, and also the other nutrients. All right. The third one, repairing the cell. So repairing cell, of course, your cells healthy. So we need to know when your body cells is healthy, so it easy whatever working system inside your body, that means your hormones, your body system, you will need to run smoothly so that you're having a good body. All right, the last one, improve the absorption of nutrients. So from, let's say you're taking food just like vitamin D, vitamin A, and also magnesium, and some of the medication, so that means your cell can absorb most of it. Because why I mentioned this one, because some of the letters are not letters, we can say some of the patient previously, they do have follow, they eat properly, they do some exercise, they eat healthily, they eat the medication, all that, but the result is still the same, not such an improvement. Why? Because the cells, because their cell is not in a good condition. So that's why you can see the number third, repairing the cell. When you're repairing your cell, so that you will improve your absorption. So whatever your food you take, whatever medication you take, it simply can absorb. So this is a four major reducing electron therapy can help most of the patient having a difficulty to having asthma, especially among the kids. All right, so as conclusions, reducing electron therapy can make your cell's body become healthier and increase your body defense. Also remember body defense? The white blood cell, your soldier, mechanism to fight the bacteria and viruses. So whatever it is, you need to know, whatever disease in the world, you need to know that is you. Whether you want to change it based on the food or based on your lifestyle, it's up to you. So that's why I said, first thing first, you need to know what are the function, what are the causes behind it, what are the type of it, and how to prevent it. Once you know everything, then you can take, you can say that you can taking care of your body. All right. So again, this is no side effect oral, and we just treat the root, not the symptom. All right. So this is our emails and hotline number. If let's say you're having a difficulty to understand our product, our topic today, and also you're having a question about reducing electron therapy, so you can like email us and you just call this number. And whenever you have a free time, you are most welcome to visit our place. All right. So far, that's all for me. Thank you so much for your listening and for your time. Any question that you want to answer? Sorry, you want to ask?
Yes, Dr. Novro Harikuji,
Yeah, yes.
I have a question here regarding asthma.
Okay. Oh, okay. Yes, Mr. James.
Yes, okay. Well, you say the asthma related to the lung disease, right?
Yeah, correct.
But is that all the so-called so-called you mentioned about the reducing electron into our body? Would they able to I mean make our lung better with that kind of disease in the lung?
Okay. So again, I just say okay. Wait. Okay, okay. Thank you, Mr. James, for your question. So I mentioned just now, yes, asthma is long-term disease of lung, correct?
Yeah, yeah.
So reducing electron therapy, it helps in terms of control your sign and symptom. So when your lung having a difficult problem, I mean a difficulty of breathing or maybe have a tear or something, so this is how reducing electron can help. So in terms of if let's say you reduce your sign and symptom, so that your lung become healthier. It's not that I mentioned for sure you do the treatment reducing electron therapy, for sure your asthma will be gone. No, it just reduce the sign and symptom. So most of the patient, most of the cases, when they reduce sign and symptom, the asthma also like slowly going away. It will be happen if let's say you not take care of yourself. But if let's say you're taking care after you use the therapy, you're taking care, for surely this asthma will be slowly going away from you. Is it answering your question, Mr. James?
Yes, yes, yes. And another question again.
Uh-huh.
In fact, my father, 90 years old,
90 years old, okay.
and previously he is a smoker.
Okay.
And
Okay.
then, and I think he quit the smoking last 20 years, but smoking more than 30 years. You see?
Oh, I understand.
So,
Okay. It just
so
stopped 20 years, correct?
yeah, right. But
Okay,
again, the
okay, okay.
lung,
Uh-huh.
he had this severe asthma. And right now,
Mm-hmm.
every day, I mean, taking the orals, wearables every morning and before sleeping.
Okay, okay.
But okay like that. But again, when he need to do so-called long distance walking, he feel no good, not feeling good, and asthma come again severe.
Okay, understand.
So my question is, can I recommend my father, elderly, taking this
Uh-huh.
electron reducing therapy?
Therapy. Okay. So first of all, so your father is 90 years old, correct?
Yes, yes.
Okay. Is he do regularly blood checkup? I mean blood report for him
Periodically every 3 months like that.
every 3 months. So the problem is the asthma. That's it. Is it the cholesterol, the blood pressure is all okay?
Or he is taking regular cholesterol bill every day.
Ah, I see. Only cholesterol, blood pressure don't have.
No, April, yes, also both, yes.
Okay, I see. Understand. How about that? How about her how about his blood sugar?
That one maintain okay.
They were maintained. Okay. So I can see that okay, how can you describe me the physically of him? Maybe he can still walking or he need like somebody to walk along beside him or he
Well,
can like move.
he walk with a walker, and then most of the time take a rest at the chair. Seldom have a walk because 90 years old. So
Understand.
seldom exercise. But when walking long distance, he feel hardly do breathe.
Oh, okay. So
Mm.
first of all, our reducing electron therapy, we do have, before this, we don't have any patient about 90 years old. The
Oh,
oldest
okay.
one we have 67, if I'm not mistaken. Yes, 67 years old.
Okay.
Is the grandma who are having diabetes. So for your
Oh,
case, it's 90 years old. We don't have any cases yet, but maybe, I don't know, maybe your father's one of the first cases that we have. So as long as he doesn't have cause of bleeding, he still can move, he can use this therapy. Okay, because asthma, again I said asthma because of the lung. So if let's say he taking care of the medication, he get the good care of medication, and the food that he like to say follow the what food that he could get. So maybe this treatment is suitable for him. If let's say you are available, you can come to our place and can give a trial.
by the
Okay.
way, electron therapy, is it just a once or just a continuous therapy?
It depends on your body. Usually we give continuous.
Or continue means every week, every month, something like that?
If let's say you are okay with that, so you can stop. It's your choice. If let's say you want to continue, you can continue. So far, for my suggestions that we have is depend on what kind of disease you have. If let's say you have a cancer, of course you need to use maybe like about 1 to 3 years. It depends how
Oh,
much severe disease you have. If let's say like last time we do have immune system, autoimmune, the skin disease. So the skin
uh-huh.
disease, we took about 3 months. You can see the result of the skin is quite okay. For after
Oh,
that, yeah, he said he just come and on and off. He just come on and off just to maintain. So if let's say this treatment is working for your father, so you can see how's the result. If let's say
oh,
you think this is you can stop, then just maintain. That's mean maintain. That's mean depend on your food, depend of how good you are to taking care of your father. Okay. If let's
okay.
say you are okay, you can come to our place.
Yeah, by the way, the electron therapy is the kind of just a taking pill or by injection or what kind of treatment is that actually? Is
Oh
it a
no,
short?
it's just an electron. How to say? It just you just relax your body.
Uh-huh.
So how to say? It's not electrical. It's just you just relax on the body. Nothing. We not injection. We not give orally. We just relax
Uh-huh.
and we give
Uh-huh.
the electron. That's it.
Oh,
Nothing.
oh,
Nothing injection. No oral or just a very natural treatments. It's a very natural.
oh, it's just short
Uh-huh.
period of time, maybe 10 minute, 20-minute kind of treatment, something
Yes,
like that.
yes, yes.
Oh,
Sometimes
okay, okay,
yes, 10
okay.
minutes and then you rest for 1 hour and then you repeat back for 10 minutes. So it depends on your body. Because before we do the treatments, we need to take your blood first to see. So from the
Oh, okay,
blood,
okay.
we will see, okay, this person, maybe this person 30 minutes, maybe this person 10 minutes. So it depends on your blood itself, how the result itself. So that's why I always asking my patient, if they say they
Uh,
come to see me, I always tell them, if they say you have the blood report from previous one, you just can bring, we can compare it later on.
I see, I see. But
Mm-mm.
doctor, we are from Penang. How to go to see you?
Oh,
Where
if
is
they
your
say you
office?
want, we office in Jalan Templer, Jalan Templer,
Oh,
Petaling Jaya.
oh, I see, I see. You have any branch
Just
in
nearby.
Penang?
I think in Penang. I think I'm not sure about that. If I think Penang have. I think Penang have. I forgot to. Maybe I will ask from my boss out there. So I will talk to you again. Is it okay with you, Mr.
Okay,
James?
okay, okay. Good, good. Thank you, doctor. Mm.
Okay, you just take the number so that later on, maybe Jenny, who's the person in charge, will convince you with the WhatsApp or how. Is it
Sure,
okay
sure,
with you?
sure. Okay, okay. Good, good.
All right.
Okay.
So the next question. Okay, thank you, Mr. James.
Thank you.
Okay, so the next question from Aima Azman. Okay, currently I've got a flu and it happened since a few months back. Suspect cause for my issue is a pet. The question is, if I want to check on my breathing, what kind of method I need to use? Okay, first of all, if let's say you have got flu, it happens if okay. So if let's say you have a pet, so before this, is it before this you don't have any difficult breathing, right? So you just get a few months because of your pet. So for me, the method, for me, please to check your check to the nearby clinic, of course, because they got flow meter. Flow meter is like to measuring how good your breathing. Okay, flow meter. If let's say you want to do by yourself at home, it's quite difficult because no one to monitor you. So if possible, you just go to the nearby clinic and do some checking. So usually they will do some X-ray if let's say you're severe, some X-ray, and also some method for test your lungs, and then of course your blood report. Okay, Mr. Aiman Azman. Okay, I answer your question. Okay, so the next one, Nur Haslinda. Okay, is true swimming good exercise for those have asthma? Swimming, okay, it depends on you also. If let's say you're swimming, you're not like having how to say hardly swimming. I mean like everyday swimming, you can build up your asthma. Sorry, you build up your lungs, it become better. So some of the swimming you can see, that's why swimmer, you can see they have a broad shoulder. Why? Because they have a lung capacity, very big lung capacity. So they for surely their breathing is very, very good. So I cannot saying that swimming is a good exercise, but we do have some research doing last time. Swimming sport is one of the, how to say, one of the good exercise for those who have asthma. If let's say you don't have a severe asthma, remember 4 type of asthma just now, we have mild, persistent, and moderate. So if let's say you have a mild persistent asthma, yes, swimming can be one of the good exercise for you. Okay, so any questions? I hope I answer your question just now, Linda. So any questions? Anyone? Any other questions? So far no question, is it? All right. So Shirin, I think no questions so far. So maybe I pass to Shirin back to continue our talk today.
Okay, thank you, Dr. Fida, for this informative sharing on how reducing electron treatment help to prevent asthma. So if you guys have any question, you can still continue to type in the chat box. Maybe if Dr. Fida see any of the questions, she can reply you through our chat box here. So we will continue on more information sharing on reducing electron treatment. So the first thing that I would like to share is about our self-defense. So what is actually a self-defense? It means that it's the ability of our own body to fight diseases. So if you have a very strong strong self-defense, it means that your body is able to help you to fight and prevent diseases. So how do we determine this self-defense? Is by considering the following 3 elements. You can see the picture below is a triangle, and each corner of the triangle represents a different characteristic. So the first one is cellular metabolism, which is very important because this procedure, which is the metabolism, will help us to convert the nutrients that we absorb into energy that our body is needed. So if our cells are not able to carry out metabolism, the nutrients will be accumulated in the cell, and then for a long time it will be oxidized and turned into toxic substances, and then our cells will be affected. They will become weak and they may die also. So once our cells are not healthy anymore, we will get sick easily. Okay. So we must ensure that our cellular metabolism is always at the optimal level. The second one is the strength of immunity. Like what Dr. Fida just now mentioned, immunity is the first line of defense against any disease. So it's very important to ensure that our immune cells, our immune system are always at the stronger side, so that when we get sick, they can help us to fight back. So the third one is the inflammation sedation. So this inflammation can be caused by a lot of factors like pollution, radiation, etc. So if we have high level of inflammation in our body, we might get higher risk of developing diseases. So which is why it's important to ensure that there is the least level of inflammation if possible. So once if we have all these three elements are maintained in a good level, we can say that our self-defense is strong, which means that our body can fight diseases. But if one of these element or more is affected, then your body will be affected as well, which is why we will get sick easily. So aside from that, our body is actually made, 70% of our body is actually made up of water. And this water is very important to our cell because they are the home to our cells. So what does it mean when our body fluid is dirty? It means that our body has been turned into acidic. So once our body is in an acidic state, it is not suitable for our cells to live in. So they will get weak, they will get sick. So when our cells get sick, like I've mentioned previously, we will get sick easily as well. So we must ensure that our body fluid is always at the correct pH, which is weak alkaline. So how do we maintain our body pH at weak alkaline for our cells to survive? Is by reducing electron treatment. So this is the principle of how reducing electron help us to maintain in weak alkaline. So you can see the left side, we have hydrogen ion, which is a positive ion that will cause our body to become acidic and then cause diseases. But once we have reducing electron in our body, the negative charge of this reducing electron will help us to neutralize the positive charge of this hydrogen ion and convert them into hydrogen atom. So once our body consists of hydrogen atom, it will help us to maintain in weak alkaline state, which is suitable for our cells to live in, and which is why we will maintain our health. So it's very important to make sure that your body has reducing electron to help you to maintain your weak alkaline state for your cells to survive. So aside from reducing electron, Dr. Novro Harikuji actually suggests 6 rules to build health. So you can see from here, the first one is reducing electron, and then the second one is to exercise. So you make sure you have at least 30 minutes of exercise per day. And the third one is balanced diet, which you must ensure that you have a balance of nutrients and also enough of water per day. The fourth one is 7 hours of sound sleep, in which is a deep sleep, means that you did not dream. So when you're having deep sleep, your body can repair itself. So having a deep sleep is very important also. The fifth one is medicine. So you must continue to use your medication prescribed by your doctor until allowed to stop. And the last one is very important also, which is the positive mind. So you need to maintain a positive thinking and also positive surroundings, like the person beside you, like your friends and family are always encouraging you, and then you always have to tell yourself that you are healthy and you want a healthy body. So your body receive all these positive signals, and then they will work hard to maintain your health. So if you follow this 6 rule, which is suggested by Dr. Novro Harikuji, you will have the ability to build back your health. So for the basic elements of a human body, you can see here what we know is that our body needs water, oxygen, nutrients, protein, carbohydrate, vitamin, fat, and others. But what actually we overlook is the requirement of reducing electron. So a research done by WHO, they found out that human body actually needs 13 billion of this reducing electron in our body to be healthy. Because we are born with this reducing electron, but like nowadays we have a lot of pollution and radiation, these factors will actually use up our reducing electron, which is why we need to give back our body the reducing electron that it needs to help it to eliminate all those positive ions and free radicals that are harmful to our body. So by ensuring that your body has enough of reducing electron every day, they will help you to eliminate the free radicals and also the positive ions in your body, and help you to maintain in a weak alkaline state, which will ensure that your cells to be healthy. So like I've said, when your cells are healthy, you will be healthy. So you will not get sick easily. So no medical book and no detailed research done in this world on the necessity for human body to be healthy, except the research done by Dr. Novro Harikuji in Japan, which is also the founder of this reducing electron. So human body needs sufficient amount of reducing electron, which is 13 billion, like I've mentioned just now, to function well. So it's very important to make sure that you have this 13 billion of reducing electron in your body every day to help you to maintain healthy. Reducing electron is also not just a treatment, but also a prevention. Like Dr. Fida also mentioned, prevention is better than cure. So preventing diseases is the assure to a healthy body. And Dr. Novro Harikuji also mentioned before that by inducing this nature's energy, which is reducing electron, into the human body, it will enhance our body's recovery and self-healing power, which will help us to fight diseases without any side effects and treat diseases fundamentally. Because like I've said, reducing electron targets our cell. So how does it help you to fight your diseases? Is by giving your body, your cells the health, and then let you to use your own body, your own health to help you to fight with diseases. Which is why he mentioned that self-healing power is by using your own ability to help you to fight diseases, because we did not give you any extra things that your body doesn't need it. And it does not have any side effects because just like I've mentioned just now, reducing electron is already in our body since we are born. So our body naturally can accept this reducing electron because it requires this reducing electron to function. So if you are undergoing this reducing electron treatment, you will not experience any side effects. We are also a root treatment, and we are not treating symptoms. Because now, like the medicine that you get from doctor, they are mainly targeting your symptoms. Like if you have pain, you have fever, it will help you to reduce all the discomfort. But what differs us from the Western medicine is that we are targeting your roots, which is your cells. So when your cells are healthy, you will have a healthy body, like I've mentioned already. And if your cells are not healthy, you may get diseases, which is why this reducing electron treatment is known as a root treatment, because we target the root, which is your cell. We make your cell to become healthy so that they will help you to fight your disease. So how many cells do our body have? Our body actually has 60 to 100 trillion of cells. So you can see that our body actually consists of a lot of cells, which is why this reducing electron treatment, which is also known as a natural treatment, actually needs time to repair cells. It is impossible that one day this reducing electron will help you to repair the 100% of your cells in your body, because you have 60 to 100 trillion of cells. It needs time to help you to repair the cells slowly and let them to regain back their health. So for the process of root treatment, it consists of 4 steps. The first step is to stop your condition from becoming worse. The second is cleaning, to help you to cleanse all the impurities in your blood, which is to help you to convert your 70% of body fluid back into weak alkaline for your cells to survive. The third is to repair all the damaged cells and help them to regain their health. The fourth is to rebuild your entire body to let you to have a healthy body back. So this root treatment actually needs time to undergo these 4 steps in order for you to regain a healthy body. So this is Dr. Novro Harikuji, which is the founder and inventor of reducing electron treatment. So he actually experienced the loss of family members due to sickness, and which is why he saw the weakness and limitations in the medical field. And then he wanted to find something that will help to reduce the suffer of human and also help them to regain back their health. So after years of research, he actually found that this reducing electron treatment can do so. And then he built up a hospital in Japan, which is Harikuji Hospital. So currently this hospital is handled and maintained by his son, which is Dr. Hiroshi. And Dr. Hiroshi also trained the doctors on how to use this reducing electron to help to treat different kind of diseases. So this reducing electron also earns a lot of awards, and the most important one is this award, which is given by a lot of different countries, that the healthcare professionals actually recognize this reducing electron treatment to be a beneficial treatment to human body to help them to fight disease and regain back their health. So we are also a medical authorized device. So the cert from the left side that you can see is from the Japan's Ministry of Health, and the right side is from our own country, which is the Malaysia's Medical Device Authority. So our machine and our treatment is actually certified by our country as well as a medical device to use to treat diseases. So why does Dr. Novro Harikuji won awards? Because he discovered and invented something that is equivalent to what human body needed. Like I said, our body needs enough reducing electron in order for it to function well. Because Dr. Novro Harikuji discovered and invented this reducing electron, so he won a lot of awards. And also, why it does not have any side effects? Like I've mentioned just now, because reducing electron is something that we are already born with, and it is what our human body needed, which is why our body can accept it, and you will not experience any side effect if you undergo this treatment. So currently we have two products. The first one is Me Energy, and the second one is IgE1J, which is the blower. So like what just now Mr. James asked on how the treatment is actually carried out is by using this both of these device together at the same time. So this big one, you can see there are 6 plates here. So the plates will be placed on your body parts. So these plates will actually produce the reducing electron. So the reducing electron will go through your skin and into your bloodstream. So it will be carried by your blood to all over your body. As for the blower, it's more targeted onto your lungs. So because it produces reducing electron, which is in the air. As you breathe in, you will inhale this reducing electron, and it will go through your nostril, your respiratory system, and then finally it will reaches into your lungs to help you to cleanse the toxins and also to purify everything. So for the best effect is to use these two machines at the same time, not only to target your lungs, but also to help with your whole body for your overall health. Okay. So if you are interested in this reducing electron treatment, or you are interested to understand the level of acidity in your blood, you can contact this number down below, which I put up here for a free trial of this reducing electron treatment. Because sickness comes from acidity, like I've mentioned, when your body is in an acidic state, your cell will not be healthy. So once your cells are not healthy, you will be able to get sick easily. So which is very important to ensure that your body does not maintain in an acidic side. It must be in a weak alkaline state for your cells to survive and be healthy. So in order to understand the level of acidity in your blood, you may contact us for a free trial, or if you want to know more about this treatment, you can also contact us for a free trial. So we will have a science officer here to help to explain to you your blood, your body condition, and also more information on this reducing electron treatment. And also besides that, we actually need your help, because this reducing electron treatment exists in the market for only 25 years, which is why this technology is still not included in the education of medical students. But from our patients, we can see the effectiveness and potential results of this treatment. As this is also a registered medical device, we are actually restricted by the MDA to perform any direct advertisement. So we need your help, like satisfied users, and if you feel like it's useful, you can help us to share about this beneficial treatment to your friends or family. So this online sharing session that we set up every Saturday is actually as a platform for you to invite your friends and family to let them to understand, aside from the Western and traditional medicine that everybody knows, there's an alternative way to help them to gain back their health, which is reducing electron treatment. So if you ever find this treatment will be useful and will help some of your friends and family, feel free to share to them this online sharing session, or also you can share to them the number that I put up just now and let them to come over, maybe to try or to learn more about this reducing electron treatment. So here I would like to share with you a very interesting talk that will be organized by our Japan doctor, which is Dr. Hiroshi Harikuji, and also our Japan CEO, which is Mr. Toyoji Shimada. So the topic for this talk will be arteriosclerosis and reducing electron. The date will be 11th November, and the time will be 1 to 3 p.m. So the language, it will be from Japanese translated to English. So if you are interested, you can just WhatsApp the number down below and just ask for the registration link. So if you contact us through this WhatsApp number, we will send you the registration link, and then you will register through the link, and then you will be automatically registered for this talk. So when we have the Zoom link, we will be shared to you through your contact number and also email as well. Okay, that's it for my part. Do anyone of you have any question?
Yeah, I have a question.
Yes.
James here again.
Okay, hi.
Yeah, well, I would like to understand that this you mentioned the so-called the medical devices for the reducing electron. So RET.
Yes, RET.
And may I know? I mean, the function is to go to generate so-called reducing electron to neutralize the so-called the neutralize the cell to be neutral, right? So how do I measure that upon the so-called Descartes treatment, the electron in our cell? Because that by reducing the cell, the body will be enhancing the immune system and metabolism. So what's a measurement skill? Can I know that about the series of treatment?
So for our treatment, actually we monitor your body acidity level through blood. So our science officer will take 1 drop of your blood. So by examining your blood test, we can tell you that whether your body has enough of reducing electron to help you to maintain your cell at a healthy state or not. So it's by looking your blood.
So it means that before and after you can do a measurement of the
yes.
electron, right?
So let's say if you come for a free trial, before you do the treatment, we will take your blood, and then after you done all the sessions, we'll take your blood again, so you can see the before and after as a comparison. Then you can then you can understand how the reducing electron helps your body to become alkaline and let you regain back your health.
Means that this kind of device to measure the blood ion is a special made from this company as well, right?
You mean the blood test?
Yeah, blood test.
The blood test is just like the normal way how you measure your blood glucose. Is by pricking your finger to get 1 drop of blood.
I know, but the device you use, what kind of device is that?
You mean for the treatment, is it?
Yeah.
For blood test, we examine through the pricking of the fingers and microscope lah.
Oh.
For the treatment is the machine that I showed just now, the me energy and the blower.
Okay. So by the way, this product is not is so-called introduced in Malaysia for some time or recently.
This device have been in Malaysia for, if I'm not mistaken, it's 10 years. Is it, madam?
Yes.
10 years.
Oh, very interesting, eh? Very interesting.
But this one is for like in Japan for already over 25 years lah, so it's quite long already.
Would there be any specific good to those who are so-called with a cancer, because that related with the cell?
Yes, of course. Most of our patients are cancer patients lah, like all kinds of cancer patients that they wanted to explore a different treatment to help them. So they will come to us to see whether we can help them or not for cancer patients.
Do you have this kind of testimonial in your website?
Yeah, we have. You can go to our website and see.
Was it?
Yeah.
Oh. Okay, where's the, how was the website?
Wait, I sent to the chat box. You can check. Do you see the website?
Let me see the chat box.
Aside from the website, actually, you can join every Saturday lah, because we have different topics. Like this week is asthma, so we will share more on the asthma testimonial. And if we have any other topics, like previously we have heart disease, we have cancer, then we will share the testimonials according to that week's topic. So if you are interested, you can join also lah.
Is it a Zoom meeting? Is it a
Yes,
Zoom
yes,
meeting?
like today lah, just like today.
Oh, okay. Maybe how should I register that in the Zoom?
You can just give us our number. Then if you're interested, we'll send you the Zoom link lah for every Saturday for the talk.
Okay, good. I put in my number in the chat box.
Okay, sure.
You can contact me. That's good.
Okay. You have any other question to ask?
Well, I would like to I would like to have a unit for my father to try and see.
In that case, I will get someone to get back to you lah for the trial part.
Sure.
Okay, thank you so much.
Thank you.
Anyone else have any other question?
By the way, at this moment, this office is only in KL only, right?
Yes, in KL lah. But for other branch, I might need to check back lah and get back to you lah.
Okay.
Okay.
Good, thank you.
Anyone else have any other question? If not, I'll just invite Madam Yi to share on the testimonials as well as more information regarding this reducing electron treatment.
Hi, everybody. I'm Madam Yi. Okay.